Good afternoon, and thank you for joining us for this webinar on community-led recovery. My name is Amanda Leck, and I am the Executive Director of the Australian Institute for Disaster Resilience. It is my pleasure to be the host of today's webinar. This is the second webinar of AIDA's new Recovery Matters webinar series, which we've set up to share knowledge and good practice for disaster recovery in the wake of our devastating bushfire season. We know that recovery is a long journey, and over the coming months, we will continue to bring a range of guest speakers with different recovery expertise to share what they know to help us to support communities to recover. Today we have two guest speakers who I will introduce shortly. But first I'd like to acknowledge the traditional owners of the land on which we meet today. Here in Melbourne, that is the Wurundjeri people, and I'd like to pay my respects to elders past, present and emerging. I'd also like to acknowledge that this could be quite a sensitive and emotional issue for many people. If this discussion does raise anything for you, I do encourage you to seek adequate support from organisations such as Lifeline and Beyond Blue. Just a few housekeeping matters before we get started. We won't be showing video of our presenters' faces, but you'll see the slides on the screen. As you would be aware, we are running audio through the phone. You will be muted for the duration of the webinar. Please use the chat function to ask your questions, and we will address these at the end of the webinar. We've had more than 650 people register to attend this webinar today, so we do ask for your patience if there are any issues. And please note that we will be recording this webinar and uploading it to the Knowledge Hub for you to view again later on. So today's speakers. We are very fortunate to have two speakers presenting at this webinar today. Louise Mitchell, the National Consultant Disaster Recovery to the Social Recovery Reference Group, and Margaret Darveniza, Manager of Community Engagement at Townsville City Council. So before we start, we're not running a poll today like last time for those of you who joined us, but we would like to get a sense from everyone of who is on the line. So please take a moment to pop your name and where you come from, whether that be an organisation or your location, into the chat window now. So we'll just give people a couple of minutes and then we can see who's joined us today. We've got a very diverse range of people from a whole range of locations across Australia and from a whole range of agencies. So thank you very much for joining us today, and we hope that you will learn a lot from our expert presenters. I'd now like to welcome our first speaker, Louise Mitchell. Louise is the National Consultant Disaster Recovery to the Social Recovery Reference Group. Louise supports the organisation who are members of the Social Recovery Reference Group across Australia as they collaborate to continue to grow human and social recovery and preparedness capability. This group shares policy and practice and advocates for the centrality of both individuals and community to successfully recover. Prior to this role, Louise worked at the Australian Emergency Management Institute for 16 years with a focus on adult education and developing and facilitating workshops to continue to progress emergency management. She keenly explores how individuals can participate in civic life both within and outside the disaster context, and has strengths-based and collaborative approaches can both build relationships and get some of the best outcomes. Welcome, Louise.
Thanks, Amanda. Great to be here. I would like to acknowledge the First Nations people of the land on which I stand, and those of the land on which you are all on, and pay my respects to their elders past, present and emerging, and anyone online who is Aboriginal or Torres Strait Islander. We value your presence here today. Thanks for inviting me to join in this conversation, Amanda and Melissa. Great to be here with Margaret and all those online, and feeling rather strange to be presenting from my home study. So to begin, I thought I'd just share a story of the lens that I look through in thinking about community and about recovery. One of the transformative times in my life was moving to a small community where I still live of a couple of thousand people just a month before I gave birth to my first child. And it was one of those life-changing markers, not just the complexity of having a newborn without knowing anyone, but how it changed my experience of community in terms of the place-based community, people and history that I began to connect with, the sense of place and connection to this country that over the last 20 years has really enriched me, and the appreciation of the diversity of this community, the multiple groups of interest, the different values that many of us have, and the threads that keep us connected to each other and to this place. And in this time of arriving in this community, I was working and teaching about disasters and recovery. So my lens on recovery and the writing and philosophies that speak to me in this space are the human and social pieces, being that disaster is about the intersection of the individual with community and their environment, and the systems that support this and people's connection to place and one another. And I just also wanted to mention as I begin that I really, and it's been shown in the literature, disaster, what happens after disaster also depends on the health of our democracies and how we navigate the tensions that will inevitably emerge when what is really a catalytic change environment, adaptation on high speed, is occurring for a whole community. I'm just going to see how I can change this to the next one. So these are the agencies that I work for, and it's rather a unique collaboration of people who work for human and social recovery in government, as well as on the right-hand side, you'll see it's not only state-based, but it's Commonwealth-based. And we do also, it's there, we have New Zealand on our committee as well. So just to contextualise where sort of the whole concept of youth community-led approaches has come from, there are national recovery principles that have been agreed to by all the states and territories and the Commonwealth on that committee you saw on the slide just a moment ago. And you'll see the 6 of them up there. And youth community-led approaches is one of these 6 principles. The principles were developed back in the 1990s and reviewed in 2008 to come up with this set of principles that were then reviewed again in 2018. So they are very fresh and agreed, and they come from the learnings that people who have practiced recovery over the years have taken in Australia, as well as pulling on the research. So I just wanted to also mention that youth community-led approaches, the principle and the underlying points that you'll see in the brochure that you can find on the ADAR website. They were also looked at by a number of communities who had been through disasters in the last revision, and the communities really emphasised that they wanted it to stay, as really successful recovery depends on using community-led approaches, and they didn't want it to be changed to consider community or community-centred. They wanted it to stay in terms of this language, and we took that on board. So over the last 2 years, for 2018-19, the Social Recovery Reference Group ran a project looking at how can government support community-led recovery and maintain coordination, and I just thought I'd speak a little to that. You'll see, and I'm sure you'll be sent the links, that we've done a literature review that's on the ADAR website. We've looked at 9 case studies exploring community-led recovery and its intersection with the coordination that's so necessary in recovery. And then we wrote a report talking about what does government need to consider when it's in the support of community-led recovery. And this is what we found, that there are, I guess, to make something so complex simplified is really difficult, but in terms of overall findings, there's really important aspects in terms of supporting community action And what it says there, enabling self and collective efficacy and supporting the capacity of communities, and also supporting community decision making. So government really needs to understand and act on sharing responsibility and power. There's a lot of nuance to these and a lot underneath each of these in terms of the action. For government, there's a lot of pressure to act and to be seen to be and doing things, and yet what we saw in the literature is that it's really important to hold the space for communities to, I guess, reorganise themselves, to come to terms with the shock of what has just happened, to start talking together with each other in order to work out what's best next for them. So at the government level, there is that pressure to act, both within agencies and the higher level political pressure. And there's a whole lot of detail that you'll see in the literature review under these 2 points. So I might just turn to talking to what is community-led actually? What does it actually mean? Does it mean wholly citizen and community initiated and led, or does it mean that there is a partnership? We've seen a lot of citizen-led activity in the relief phase of recovery around meals, donated goods, thank you cards for emergency services workers, and I'm particularly talking about the fires. I haven't stepped into COVID-19 and its overlay at this point. And if there's an active body in the community already prior to a disaster, you might see them involved with activities, planning and decision making after the disaster. You know, community hall committees, sustainability groups, local government can be, you know, and it's what your community considers it to be. Is that representative of your community, and does it mean community-led if it's local government-led? In this report, I included local government more in the government section. So does community-led mean greater government facilitated support? So usually after a disaster, there are citizen and community initiated led activities that do link into government, and most often it's to access resources or to sustain their efforts, and sometimes it's to seek advice on how this environment is. So in the case studies that we did, Sherwood in South Australia, they had very active community leaders who worked on their recovery, and they tapped into the advice and support that government was able to provide on what is this new novel environment and how do we navigate it. So even in citizen-led initiatives, there are links to government organisations. And so where I'm going next is how we framed what community-led looks like in recovery, and it looks like you'll see in the orange this space of co-production. So I'll just see if I can get this marker working. So this is the space of co-production that we're talking about, where really we're working together towards shared goals. On the left-hand side in green, you'll see individual residents and community, and what is labelled there as a complex adaptive system made up of informal groups such as your choir, your youth groups, or maybe they are more formal and have governance structures like your sporting groups that has its committee meetings, your asylum seekers support group, your men's shed. And as they become more formal as you go towards the right, and more integrated into the funding arrangements and requirements of the public agencies, I'm just pointing to the neighbourhood house, for example, there, they'll have governance requirements, reporting and communication requirements. So where am I going that? So really where we are in recovery is bridging kind of the developmental approach that needs to occur in communities that have an energy about them and do things often in a voluntary way with the more formal hierarchical things that are happening in organisations in supporting recovery. So I just wanted to also talk about, you know, after that slide about the who, just in terms of how our societies run, here's a diagram that looks at disaster response and recovery as a whole community affair. It's from a great resource that the link is there from California. It's called California's Building Disaster Resiliency. So thinking about who is involved and who do we consider community and who do we consider government is a really important question. And do note that this is not the same in Australia. So you've got here FEMA, the Federal Emergency Management Agency, and in Australia it is different in the detail. But you'll see that this is a single family's journey. The blue circles are where government support is provided. The grey triangles are the non-government support. And the yellow circles are where they see the role for volunteers and donations. So as you traverse that one person's journey in receiving supports, they're receiving supports from a whole lot of different partners in the recovery journey. So the government agencies I work with in the States work alongside the people in the local area to provide those supports. So the evacuation centres, relief, case management support, they'll try to find local agencies who are able to provide this with the assistance of government funding. They'll also walk alongside local government to build capacity where needed in standing up their governance and coordination of recovery for their local communities. And perhaps even running through, if this is what the community wants, how to set up a community recovery committee. So some of these services are taken on by community-based organisations and funded by the state or federal government. Others of these are funded maybe through appeals funds that non-government organisations have received. And we also saw a lot of action from philanthropy and corporate donors this season as well. And so I know that some of that funding is waiting to meet what we know are the long-term needs of communities. Some of it's being distributed now, and others we know the needs will go on for many, many years to come, and typically 2 to 5 to 10 years. So disaster response and relief and recovery involves the whole community. So the next slide I wanted to just share with you was the fact that the question of when is the right time for community-led or co-produced action and decision-making. And you'll find this diagram in the Community Recovery Handbook of that ADAR hosts. So sometimes it's when the threat has passed from the Great Disruption and they're able to set up formal structures. So you'll see here's, response and relief, assembly and registration. Some one-stop shops and recovery hubs might have been set up. And as the social function is repairing and people start talking with each other, you can get those community structures driving more community-based recovery. And so that can actually, that goes around to the community being its normal self. No, I just heard, I had a disruption in my ear there. So that goes around to the community heading back into a non-disaster context and having adapted to its new context. And community-led recovery needs also to fit in to, I guess this is on that right-hand side, the coordination and governance that's been set up. So as I said before, the energy of the community, the organic processes in community-led, fitting in with these coordination structures is not always is not always an easy thing. We know it's not. So I know I have probably 1 minute left, so I'll just tell you about plant some seeds basically, and tell you about some of the things that we've looked at and some of the resources that you can have a look at. Because in looking at really trying to advise on how government can best support community-led recovery, I went and talked to a whole lot of people. In Queensland, we looked at the appeal committee and found that really it was about having good governance and involving local voices that had clear roles in why they were sitting on that committee. In Bundaberg, we looked at a case study around rebuilding houses and how they actually came together, government and community and volunteers, to do some decision making, form a community-driven association, write up some supporting documents for those volunteers, and do action learning as they went and change and tweak what they were doing. We looked at asset-based community development model in Gippsland, East Coast Tassie. We looked at how they actually employed a community development officer to assist the communities, to act as that partnership broker between government and community voice. In Yarloop, we looked at the collaboration with government in their community resource centres or neighbourhood houses. In Sherwood, as I mentioned before, the community leadership and the government was actually invited in by the community to advise. And in Nauru, it was earlier on, like the relief phase, but it was just such a privilege to do this case study around looking at what enabled the smooth running of their evacuation and repatriation, and that was strong community agency relationships and the growth learning mindset that was held by and the leadership in the community around that. So in the report, you'll see some of the goals of government supporting community-led recovery, what success looks like, and how you might do it at this organic end. Listen, hold space, support and enable. When in this space of co-production, to partner, collaborate, recognise and build capacity and capability. And at this end of the real organised structures, coordinate to serve community priorities, adapt your policy and intervene appropriately. And so walking the recovery journey has sometimes been referred to as walking the chaotic path, the path between order and chaos, or emergence and that order and control. If it's too much control, it's stifling. If it's too much chaos, there can be breakdown. So I really like that as a model of thinking about recovery. And I dragged this picture out of one of my slides, and our communities are looking very different now to some of the images on screen with the restrictions in place for COVID-19. So what does this mean for recovering communities? Because one of the key ways we heal after such intense collective trauma events such as the fires that threatened and took lives, houses and our wildlife and animals, and decimated our natural environment, is to gather together. We are physical beings and we're interdependent, and the social environment in which we live and gather has a real effect on how we feel, see ourselves and how we get along. So I'm seeing, as a result of the restrictions that we're all embracing, is some hopeful stuff and some hard stuff. The hard stuff is what I've just talked about. We can't gather together face-to-face and physically. But what is hopeful is that I'm seeing people in communities trying to work out what to do together, to work out their solutions. And I think for government it is how can we involve community in creating the solutions and support them with the resources that are needed. So just to let you know that these disaster recovery principles have a whole lot more detail in them. On the ADAR website, there's a checklist there that's drawn from the principles that you might want to go to and use and think about in recovery. And just, my main points around co-production, government being receptive to listening to community voice and building capacity in communities and government to enable co-production and public participation. Thanks, Amanda.
Thanks very much, Louise. That was a very insightful presentation. I'd now like to turn to Margaret Darveniza, the Manager of Community Engagement at Townsville City Council. Margaret is the Team Manager of Community Engagement, and she has worked in the area of disaster recovery and community development for many years in a number of locations across Queensland. She has worked in disaster recovery for the Cassowary Coast and community development in far north Queensland, Gympie, and through contract work into communities all over Queensland. Her experience in recovery is both from the perspective of a community leader in a voluntary capacity, as well as working for government and other agencies. So please, while you're hearing from Margaret, please continue to put some questions into the chat box, and we'll be facilitating a Q&A after Margaret's presentation. But welcome, Margaret. Thank you.
Thank you for the opportunity to share our story, and can I echo my colleagues and pay my respects to the traditional owners of all the lands on which we're living and working, and pay my respects to elders past, present and emerging. No two stories of disaster recovery are the same, and no two communities are the same. Disaster recovery, particularly community recovery, really is a place-based exercise. And I hope that my presentation today, which comes from the lens of a practitioner, will challenge and expand your thinking, provide some practical ideas, or maybe validate your own practice. In a very short 15 minutes, I hope to give a little bit of context, discuss a couple of underpinning perspectives, and tell the story of some of our community-led initiatives and what we learnt. Townsville's a city of nearly 200,000 people in tropical North Queensland. And starting on Australia Day in 2019, it rained, and it rained, and it rained some more. A week or more of rain, described as a 1 in 1,000 event, saw the Ross River Dam reach a level of 247% capacity. The Townsville Local Disaster Management Group was stood up from the 30th of January to the 11th of February. There was a minimum of 3,000 homes that were impacted from flooding rivers and creeks, plus more from water ingress and storm water, not to mention the damage to businesses and employment, the built infrastructure and the natural environment. Having lived and worked in far north Queensland all my life, I've had several leadership roles in cyclone recovery, firstly as a community leader, then as a not-for-profit agency rep, and finally in local government. But this was my first flood, not for cyclones. As in per the introduction, my first standard role is as Team Manager Community Engagement, but in the fine print of the PD it says that in the event of a natural disaster, I assume the role of Human and Social Recovery Coordinator within the disaster management framework. And that's the perspective that I'm talking to you from today. To be honest, I think my personal story, blending both community development experience and disaster management, meant that community-led recovery was just intuitive for me. It was a no-brainer. I know that people don't want to be done to. They want to contribute. They even want to drive their own recovery. As the people's people, our leadership group consisted of a range of stakeholders: government, local, state and federal, community agencies, not-for-profit volunteer groups, funded service providers, and community members individually with a particular interest or a leadership role. We came from the paradigm that recovery is a marathon, not a sprint, and that the work that we needed to do needed to be a partnership, not a dictatorship. We also valued the place-based approach, and we were very clear that our remit was about our city. We acknowledged the bigger picture of the region and the state, but our focus was clearly on our backyard, Townsville. I know some of my colleagues have joined this webinar, and I just want to acknowledge their contribution to Team Townsville and to our recovery, and to thank you for allowing me to present on your behalf. So strong is the commitment to collaboration that the leadership group met on its 1-year anniversary in February 2020 for the 47th time. And although the group was formally established for the monsoonal event and has an official recovery role, we met informally yesterday to discuss the impact of COVID-19 and the current and future needs of our community. 30 plus people on a teleconference on individual lines. That was fun. Interestingly, when Louise and I discussed the role of local government in community leadership and recovery, I've often remarked to her that the best thing that we can do sometimes is just get out of the road, often with a short and emphatic adjective. And whilst I do say this in jest, there really are some times when it resonates. So looking seriously at the role of local government in facilitating community-led recovery, I think the first thing to point out is that social recovery differs remarkably to standard emergency management response, which in many cases is characterised by command and control. Community social recovery requires a much flatter response and features the building and facilitation of connections. It also differs from other areas in recovery because local governments usually have limited assets and resources in the social space. This is a field where traditionally the bulk of the work is done by not-for-profits or the service providers, unlike, for example, road maintenance or waste collection, water provision, which is local governments where they're the predominant provider. But because local government is the level of government closest to the people, we're perfectly positioned to build connections. Connections between organisations, between government and organisations, between individuals and organisations, and so on. And we facilitate the use of those connections to acquire intelligence and to use that intelligence to take action and in particular to inform advocacy. In terms of intelligence, a single point of truth is very hard to establish post a disaster, especially in a big city and with multiple stakeholders collecting data in different formats. But it's important that we try to paint as rich and a complete a picture of the impact, the needs, and the assets that we have to support that recovery in an evidence-based way. And then based on this intelligence, local government and its partners to proactively seek the appropriate support and assistance based upon what is really needed. So in short, it's my position that local government is critical to the empowerment and facilitation of community-led recovery. And this is as much about how you think about it as it is about what you do. I'd like to briefly share with you this model, which I think links well to the concepts that Louise was talking to you about. And I use it to describe the way that recovery activities are usually a blend of government influence and community leadership. Bearing in mind that every project differs according to its nature and the capacity of the community to lead it, and that then informs the degree of government influence that's needed. And that government influence might be intense or it might be rather subdued. The level of community capacity also changes, as we know, over the evolution of a recovery, and that influences the community's propensity to lead. I'm sure we've all experienced the early days of recovery when community members are totally fixated on basic needs. And then as the journey goes on, and at later times, they want to know and influence the rebuild in all of its facets. I'm certainly no academic or a researcher, but as a practitioner, I like to look at the projects that we're running on the two axes that this diagram presents. So now I want to tell you a couple of stories to illustrate the things that we did in Townsville and the concepts that I've been showing to you. One of the structures that we established to ensure that there was community leadership was to establish task groups. And this was done in response to the needs of the particular event in our particular community and may not be the same for another community or another event. These groups were chaired by community members. Council provided admin support and a degree of governance, especially where the capacity was low. And these groups identified the projects that needed to be done, sourced their partners, and largely drove the projects. We had a task group that addressed the needs of vulnerable people in our community, with our focus being on those from a non-English speaking background, people with disabilities, and seniors. We had one that looked at all the issues around mental health, another that's focused on Aboriginal and Torres Strait Islander community members, and another one that looked at young people. The young people one didn't actually last very long, and there was a lesson for me in there that I wanted to share with you. When we set it up, I really don't think that the community themselves brought the right people to the table, and largely because there wasn't any young people. And that I think is a real message. And I also think that the people who were trying to drive the task groups was very busy in their own work. And there was messages in there for us as we went on as well. Membership of these task groups was largely reps of organisations and agencies, but there were still some individuals, in community leaders who had passion in a certain area. And they're still going, and they're still driving projects for our community. We're working, amongst some of the projects that are on at the moment is a disaster translation project, person-centred emergency planning. We're working with one of the universities on that, and to work to increase the representation of skilled Aboriginal and Torres Strait Islanders who work in recovery. What you're looking at there in the picture is actually two of the task groups coming together because they realised that they had a commonality, and that was the task group for mental health and the task group for Aboriginal and Torres Strait Islanders. Each of these task groups evolved and morphed as they needed to during the time of our journey. This is what we call the social sweep, and it was the birth of Team Townsville. Essentially, a community group, YWAM, Youth with a Mission, and supported by other members of the church fraternities, decided that we needed to make sure that our community was okay. And they were going to do a door knock. And over 2 series of door knocks, they knocked 17,000 doors. All community people, all volunteering, all going out, checking on their neighbours, saying, how are you? Is there anything you need? And referring them on to other providers. Was that a perfect exercise? No, there's a lot of lessons that we learnt out of that one too. One for me was not to get hung up by the perfection or lack thereof of the data. This was actually about community, talking to community. And we've been tossing around ideas at the moment on how this might apply in an era of COVID and social distancing, as there's still strong concern in our community for the well-being of those who are not traditionally connected into the system. The spirit of Team Townsville, #whatever-it-takes, lives on and has been a real asset to our ongoing community resilience. If you think back to my diagram with the 2 axes, this was an example of high community leadership, medium government influence, and that was largely around resourcing and the provision of materials. And by the time they went out and did the second sweep, the government influence was even less because they were up and running. Here are some examples of what I consider to be high community leadership and low government influence. The Floody Legends on the right of your screen was very unstructured. Neighbours helping neighbours with the media getting behind it. And never underestimate the power of the media in community activation. There is nothing more powerful than a community led by spontaneous volunteers just getting in there. And I can imagine a lot of you are sitting there nodding your heads. The orange-shirted Samaritan's Purse is an example of more formal volunteering. If you haven't had the blessing of working with this organisation, they are a well-organised, well-equipped, experienced, faith-based workforce that went in and did a lot of the hard yakka in the short term. The role of our agency partners was essentially just to refer people in need or provide volunteer workers to supplement the Samaritan's Purse team. They just went in and they did the hard work. The Townsville Toy Library up the top was seriously impacted, and they lost their facility and all their toys to Blackwater. Homeless, and they needed to find another home. Lucky they had a dynamic committee who were determined to re-establish and reopen. And all the support they needed was largely reassurance, information halls and buildings, and links through to philanthropic and service organisations who could support their journey. It has been a great story. And at the moment, we're working with some champions, individuals, who started as grassroots community leaders. You know the type, the ones that set up social media platforms. And then they go out and they check on each other. They support each other with the delivery of meals and providing a helping hand. Now those champions are assisting with advocacy and helping their neighbours to negotiate with insurance companies. They're holding cafe conversations where people can unpack and debrief their experiences. They're starting pay it forward initiatives and many more. We're seeing now, and I'm sure you are too, that this sort of activity is happening in the COVID-19 response. Neighbours helping neighbours. I honestly think that the bulk of the community recovery is done by those who don't do it as part of their professional role. My final example, although I could have shared lots more, is one that is directly translatable to the current context. As part of resilience building through community connections, and as part of our Monsoon Recovery Community Development Program, we printed the G'day Neighbour cards, the blue ones, and provided to communities to share so that they could be more prepared within their streets, their complexes or their neighbourhoods for the next event. We've now transferred the concept to the new situation, slight rebranding and a change of colour. This project obviously was council-led, so there was high government influence, but it was done so that neighbours then can have their own community leadership, passing on the baton. So to conclude, can I just reiterate that my examples were right for our community and our situation? You've probably got many more of your own, and I acknowledge the experience and expertise that's sitting out there in webinar land this afternoon. Thank you for this opportunity. I hope there has been some message for some of you in this, and I look forward to hearing of the great work that happens when we put leadership in the hands of the community. Thank you.
Thank you very much, Margaret, and I feel like I want to applaud you saying that, leadership in the hands of the community. We've had some questions come through, so I'm just going to facilitate a Q&A with some of those key questions for the next 10 minutes, and please feel free to add your questions into the chat box if we can get to them. So, Margaret, the first question for you is around, for Mary Jane, how did the City of Townsville call out for people to join the task forces? Was there a criteria? And did you need to limit the task forces, or did they occur organically? And there's another question that's linked to that from Rob around, can you give some key examples of what the focus areas were for the task group? So can I go to you, Margaret?
Yeah, essentially it's a bit of both. We actually could see from our leadership group, or all of those agencies that are sitting around the table, what was the key issue. So for example, if you take the issue of those vulnerable people within our community, that was self-evident that we needed to do some more work in that space. So there's some of our partners already work in that space. So they identified a few people who might be interested in coming on to that task force, and then they identified a few more, and it was a bit of a pyramid. But we also made sure to get the governance right, that we did things like set up terms of reference so that they were quite focused in what they had to do. We didn't tell them that. It was the stakeholders that came to the table on that particular interest point, set up their terms of reference. And in terms of membership, it's sort of a bit of like a tree system. Not everybody sits at the table, but then those that sit at the table then go out further and continue to spread the messaging down. And the membership of the task force has changed over time too. As the recovery journey evolves, you need different knowledge and expertise at the table. So some people have seen that they've done their bit and moved on. And then we've identified that, well, we need somebody with this sort of understanding or this personal lived experience, and then brought them to the table.
Thanks, Margaret. There's a series of questions around the role of young people in community-led recovery and task groups. And the question is, how can we engage young people more in disaster recovery and other questions around, the difficulty of meaningfully engaging young people. So I'm not sure, Lou, whether you'd like to comment on that, or Margaret?
I don't know that I have any answers for you, Amanda. I'm sitting working from home with 3 teenagers in the house on holidays. I did engage them last night in folding pamphlets for the neighbourhood house around COVID-19. But yeah, it is a challenge, and I'll have to think on that. Sorry, I haven't got an immediate answer.
Yeah, I think I did confess that I don't think we did it well. But some of the things that we did learn as we went along, we identified a lot of the grassroots young people who were doing leadership activities, and we actually acknowledged them through a series of Young Person's Resilience Awards, and then started to actually bring them into the fold. So I suppose it was about seeing where the organic leaders were, and then trying to work more with them.
Amanda, another thought there is, I know that our local council has youth represented on their emergency management committee. So they're actively trying to engage youth in these issues. So that might be a point for people. Yeah, but it is still a challenge, isn't it? Just trying to get them involved in thinking about the collective. And there are some fabulous youth leaders out there that we can go to.
Okay, I'm not sure who would like to answer this one, but Marg asks, I'm curious about how to support divided communities or communities that are not particularly cohesive.
I suppose my thought would be, in all of these things, you go for what makes us the same. You look for the common element as opposed to what makes us different and what makes us fractured. So if you're in a recovery situation, what are the elements that tie us together, and how can we then invite people to the table to look at those elements?
And it might also be worth exploring what's the source of the division. We ran a workshop back in 2013 looking at working with communities in conflict after disaster, and some of the things that came up were conflicts over structure and boundaries that had been put in place, interests, what people wanted, what organisations wanted, values, and also relationships and pre-existing relationships. So just trying to work out what the source of the conflict is, and then how you might deal with it when you know whether it's interests or values or relationships. And one of the things that came out of that workshop was sometimes, especially for some of these workers who had been doing recovery for very many years, it wasn't something that they could actually solve.
Okay, so I'm interested now to turn to the sentiment around council. So Kirsty Jagger has asked, has supporting community-led recovery in the way you have in Townsville led to more positive community sentiment about council more broadly?
I would think so. Yeah, I would say it has, absolutely. I think there's quite a lot more respect for the work that we've done, and the respect across the other agencies and the partners, and then that trickles down right through the whole system. I think it's been a good trust building exercise.
Okay, so we know that mental health is a key issue for recovering communities. So what were some of the mental health initiatives, Margaret, that were created by the task group, and were they successful?
Yeah, there was quite a diverse range. Let me just pick a couple. The mental health group was really helpful and supportive in helping the whole recovery with the messaging, so that we were saying the things that people needed to hear, that we were sending the messages out in the right way. So they were informing a lot of that, which was really very useful for us, I think. They also made sure that we were cognizant of issues that might normally slip under the radar. One that really pops to my mind is the notion of caring for the carers. You know, often we look at, you know, who are the people who are impacted and what can we do to look after them, but we also needed to look after the people that were in those positions that were providing, you know, the recovery support, etc. So we had, you know, various different activities that were to support those and self-care initiatives. As a council too, we actually put on a mental health expo after, I think it was probably about 7 or 8 months after the event, where we're, like many local governments do for expos for sports or whatever, but we brought together a lot of the various different wellness activities, various different providers, various different services, so that people could come into one of our beautiful parks, walk around and access a whole heap of information. And the real blessing of that was that we did get reports from mental health services that they had 4 to maybe 5 people came to that expo and identified as being seriously in need of help that hadn't picked up the phone or walked through the door. So that expo in itself may actually have made a major difference to a few people's lives.
Thank you, Margaret. Now, there's a few issues or questions coming through in relation to COVID as a disaster event that's perhaps a bit more intangible. So there's a question around being interested to hear more ideas for recovery after COVID or for a long pandemic event such as this. So would either of you like to comment on those sorts of recovery approaches?
Amanda, I can talk to the case study that came out of New Zealand that I think people would find very interesting. After the series of earthquakes and that they had, they realised that they needed to look at universal strategies to prevent people from, so community-based strategies to prevent people from going up, I guess, that pyramid to requiring more mental health clinical support. So using those community-based strategies, and it's the All Right campaign that they implemented that I'm imagining many people will have heard about. And what was interesting about that was that the funding was given with a broad goal or outcome, but locally they could determine how they implemented that funding to respond to the needs of the community at the time. And so they created a program that built community action, an agency and a network of champions in the area of psychosocial wellbeing and really normalising having mental health conversations. And you can find them on Facebook and also in the case studies that we wrote up. So that's a good one that is now still going in the COVID-19 environment that supports people's mental health if they want to be a part of that.
Yeah, I'm finding the COVID experience to be really interesting in that traditionally, you know, you have your response phase with any other sort of a disaster, and then the response is over, and then we move into this thing that we call recovery. And I've found even in my own backyard, where basically our recovery group is not supposed to be in recovery because we're not in recovery. But we're in recovery right in the middle of the disaster. So there is a real sort of a tension there between we're actually starting recovery type initiatives as a form of response.
Yeah, and I think because this is going to be a long time, it's going to be many months of having these sorts of restrictions, that communities actually supporting each other at the local level will be really important and working out how they can do that together. So I'm involved in my own local community neighbourhood house who are connecting in with other local groups to really think about what we can do to be preventative for people feeling isolated and not having enough food and things like that. And I know that there's state-based responses as well as federal as well. But I think there is something about a local response and feeling connected to people whose faces you know and have seen before. So I agree, Margaret, it is really interesting space in terms of kind of being in recovery at the same time as a health response is taking place. And I think we do need to think about those people who will be more susceptible to this, because the vaccine will take a good deal of time into the longer term, those immunosuppressed or elderly, and how we are going to continue to enable them to feel socially connected, in our communities.
Well, thank you both, Margaret and Louise. I'm afraid we are going to have to wrap it up now. There has been some questions around family violence in recovery, and I think that will be the subject of a future recovery webinar, but I will reference the work to the people online of the GAD pod, and we'll put a link up there for you. They've developed a lot of knowledge and research and resources around family violence following disaster events. On behalf of everyone who has attended today, and we did peak at around 295 participants, I'd very much like to thank our guest speakers, Margaret and Louise, for sharing your knowledge and experience and your time with all of the people online today. It's been a really insightful session, and I've certainly learned a great deal, and I hope others have as well. We'd like to keep finding out from you online what topics you would like us to cover in future recovery webinars. So we did send out a survey post the first webinar, and we have pages of suggestions from you, and we will try and work through those over the next 12 months or so, but you will receive another short questionnaire from us at the conclusion of this. I know that everyone joining this webinar has an interest or a strong interest in effective disaster recovery. So I'd like to take this opportunity to invite you to share your feedback about the National Disaster Recovery Monitoring and Evaluation Database. It's hosted on the AIDA website, but you don't actually need to have used the database to contribute to the evaluation underway. We're looking to improve it based on your recommendations and feedback. So please click on the link we will send you out. We'd love to hear from you and your responses. We will be sending you a link to a recording of today's webinar. It will probably be after Easter now, and that will go out to everyone who's registered, and including those who were unable to attend today. So please feel free to share that. And I also encourage you to explore the recovery collection on the Knowledge Hub, which is where the webinar recordings are hosted alongside a whole suite of other resources, such as the Community Recovery Handbook that Louise mentioned, those case studies that the Social Recovery Reference Group has produced, some knowledge into action briefs that distill the key recovery principles down into short, sharp information briefs to assist you to work with communities. So thank you to everyone for joining. Thank you again to Margaret and Louise, and good afternoon.